Hey everyone, welcome back to Wellness Unscripted. This episode is just a little bit different. I'm here live with my guest, Alina Muller. She is a fantastic occupational therapist, personal trainer, and the owner of Eastside Athletics. So I'm excited for her to be here with me today. And we've got a fun episode planned. So we are both in the health field because we care deeply about doing things the right way and with intention. But that doesn't always mean that we've gotten it perfectly. So today we're going to share some of the stories about how we've missed the mark on our health, on our own health journeys, and kind of what that meant for us and how that helped us evolve into the practitioners that we are today. So thank you so much for being here with me, Alina.
Thanks for having me, Cara.
Yeah. Okay, so before we jump into the fun, juicy stuff, let's back up a little bit. I think it's important to understand a little bit about kind of where we came from and what got us here, because we've both had some, we've taken some left turns in our careers, in kind of similar ways. We both started in conventional medicine and then have stepped off to our own practices. So can you start out by telling me a little bit about the how and the why behind that shift?
Yeah. So I decided on occupational therapy as a career when I was like 14 years old. I knew I wanted to work in the health space. And I did this thing called peer tutoring in high school, where basically I would spend a period a day with my peers with disabilities. And I would join their PE class and I would spend time with them and help them engage in physical education. And I don't know, it sparked something inside me. I realized that even though these kids, a lot of them were non-speaking, if you could just like see someone for who they were and help them engage with life in a meaningful way, like it just changes something. And I built these like friendships with kids who weren't really friends with their typical peers. And it was incredibly fulfilling for me. And so that kind of led me to, look for this career where I could work with people. I think for me, I've always had this understanding that health is not just physical, it's not just mental. Like there is no one without the other. And occupational therapy felt really aligned with that. And so that is why I went to school for occupational therapy. And I think that, in theory, that's what occupational therapy should be in our healthcare system, with all of the constraints there. That's not what it looks like in practice a lot of the time. And I think that I was really naive to what it would actually look like in practice when I decided to study it.
So just as a quick aside here, if I can interject, can you explain a little bit of the difference between like what does it mean to be an occupational therapist versus a physical therapist? Because I think a lot of people are familiar with what a physical therapist does and what that looks like, but not always the nuance of what an occupational therapist does.
I don't think many people understand what occupational therapy is. Okay, so I always give this example. So like say we're driving home from this, and you're in a head-on collision and you are paralyzed from the waist down. A physical therapist is probably going to work with you to like regain any function that you could in your lower body. And they also might work with you on like strengthening your upper body so that you have the strength to like transfer yourself on and off a toilet and do more of your daily tasks, using your upper body. But an occupational therapist is going to come in and be like, what are the things that you need to do to live your life? And what are the things that are most important to you? And how do we keep you like mentally sane in this like huge life change? Yeah. So an occupational therapist, I mean, there's so many roles you could take here, but like some OTs will work with people to like adapt their car so they can still drive using hand controls. They're going to teach you how to get on and off the toilet, do your activities of daily living, how to care for your child when you don't have the ability to stand anymore. So an occupational therapist comes in and says, like, what are the things that are really important to you that you still need to be able to do to function in life? And like, how can we do those things?
Yeah. So it's really a lot more about integrating these the therapies into your life and
Yes.
into your priorities and into your values.
Yep. And it's really about like what is important to the client, because for some people, maybe driving again isn't the most important thing. But skiing is. So like there are therapists that are like up on the mountain with people on mono skis. You can take it in so many different directions. But the reality is most occupational therapy is not that fun. It's people in the hospital and we're just trying to get you to like sit up on the edge of the bed. Just like really basic stuff.
Yeah.
Yeah.
So that's the kind of role that you had found yourself in?
I ended up going into pediatrics pretty quickly. My first clinical experience was in an acute care setting, and it was a lot of this just like really low level stuff. And I think I was, again, very naive to how sick people actually are. And it opened my eyes to like what life looks like if you don't take care of yourself.
Yeah.
Or you don't have the tools to take care of yourself or the resources. But yeah, it was a lot of just like wiping people's butts and showing them how to put their pants back on.
Yeah.
Yeah.
Yep. I was on the other side of the bed in that instance, so I'm familiar.
Yeah, and it just felt like you were intervening too late, you know, and the things you were doing were just like a drop in the ocean.
Yeah. So going off on your own and starting a business is a pretty big leap. Was there like a specific moment or a series of moments that made you think like, I think I have to go do this?
I love this question. I mean, if you asked me 5 years ago what I would be doing, I would assume I would still be in the occupational therapy profession. Working in fitness and owning a business were never part of the plan. So I transitioned into the fitness space maybe 4 years ago, and I was working at a gym in California. And then about 2 years ago, my husband got the opportunity to move back to the Seattle area, which is where we were both born and raised. And so that just felt like we had to take that.
Yeah.
But for me, it left this like big question of like, what's next? Because I had left my career in occupational therapy, very happy I left that. The idea of going back to it didn't excite me, but the idea of starting a business terrified me.
Yeah.
And there are so many nights where I just like would lay there and I'm like, well, what do I do next? I have no idea. Like it felt like this like blank slate and I could take life in whatever direction I wanted to. But I think that anything less than starting Eastside Athletics just felt like a compromise, or like I wasn't realizing my full potential. Like I just knew that if I didn't go for this, I would regret it as much as it terrified me. And so, yeah, I just listened to that and decided to go for it.
Awesome. Yeah. I had a really similar story there. Is I knew I was interested in the health space from like kind of the teen years is when I really kind of understood that how you feel makes a big difference in how you experience life. So I started looking into, nutrition programs, into personal training and things like that. And ultimately what I landed on was nursing because, I mean, there was a effect of the stability. Like, you're going to make some good money doing nursing. You're always going to have a job, but also you get to help people be healthy at their most vulnerable times. And that's really what drew me into the nursing field. And throughout nursing school, I spent some time at different adult hospitals, and I was so discouraged, even as a young, naive nursing student, because you were taking care of people who weren't taking care of themselves. And you're coming in and you're, wanting to give them good care and help them be as healthy as you can. And then the second they go back on the street, they're not taking care of themselves again. They don't care. It makes it almost impossible to care about the work that you're doing when that's an overwhelming majority of the patients you're taking care of. So I went into pediatrics because nobody cares more than they do about their kids.
Yeah.
And parents will actually, was my impression, that parents will actually do the work to follow through with these things.
Mm-hmm.
And that's not the reality that I found. You know, it took me several years in the hospital to fully understand that what we were doing was not educating the parents on how to better promote health with their kids, but instead to just offer them the quickest band-aid and then send them out the door. So like I'd see these kids coming over back like over and over again with the same problems and the same problems that their parents are having. And like we were just teaching diabetic kids to, you can eat whatever you want. You just have to cover it with as much insulin as as carbs that you're eating. And it's like, wait a second here. This is not the full story. This is not creating health. This is just kicking the can down the road to whatever future disease you're leading up to. And it was like, there was one doctor there who was a complete outcast by offering dietary interventions to Crohn's disease patients they have bowel disease. And he was the one doctor in the entire top 10 pediatric hospital who was fighting the system to offer nutrition advice to these patients. And he was looked down upon from all of the other doctors. It was something to see. And that was one of my first moments of like, something's not right here. There were a handful after that, but ultimately it was, there was a huge moment shift. In 2020, I had my baby, went on maternity leave, and then COVID hit and the whole world turned upside down. Then my unit turned into the COVID unit. There's a whole long saga here, but basically it forced me to take a step back and reevaluate what I want to push for. Do I want to push to go back to the hospital, to these systems that I saw were broken and not aligning with what I know we should be doing to help these patients be better? Or like you, do I go out on my own into the, scary world of now being a business person, and forging your way on your own to practice the type of healthcare that I know we need now more than ever. So like you, that's the path I chose. And that's why I'm here today.
Yeah.
Happier than ever.
Right.
Still scared from the, a lot of,
really interesting though, how we both kind of like had these initial experiences and then decided to shift to pediatrics because it felt more hopeful.
Yeah.
Yeah.
That's exactly right. It felt like there was something that you could actually do there.
Yeah. Because, we want to start instilling these behaviors early. Like when someone is 70, it's like we can do things. And I'm glad there are healthcare providers that do work with those people. Like we need it.
Yeah.
But it just, have you heard of the phrase moral injury? Yeah. That's what it just felt like. It just felt like this accumulation of like, I'm trying so hard and I feel like I'm just not making an impact.
Yeah.
Yeah.
Yeah. Now we are making huge impacts, some of them more successful than others. So that's a perfect transition into the next part. So tell me a little bit about some times where you've made some missteps, had some learnings that came from it, and what does that look like for somebody who is a health expert?
Yeah. Are you looking for like health missteps in my own health journey, working with others?
Let's start in your own health journey.
Okay. I've made a lot of mistakes. Outside of, there's this period in my life, probably from like 17 to 22, where I just completely neglected my health. As a lot of college students do. And I was just like head in the books and wasn't exercising, wasn't doing any of those things. That was a big misstep. And I, had to really work my way out of that hole that I dug myself into. But I think more recently, the big one that comes to mind is there's this period of like 3 years where I was training really, really hard and frequently. And I swear for 2 or 3 years, could not sleep through the night. And I was trying everything I could to get myself to sleep except for taking a step back with my own training. And I think in the last 5 years, that's probably the biggest mistake I've made, and happy to be on the other side of that. But yeah.
But it's counterintuitive, right? You think if you train really hard, you're going to be exhausted by the end of the day and you're just going to pass out.
Yeah.
But
And
that was not the case.
well, I fell asleep real quick, but I could not stay asleep for the life of me. Yeah. Yeah. That's
Okay.
probably the big one.
Yeah. And what came of that? How did you figure out what was going on? How did you learn to take a step back?
Yeah. I think just really learning to actually listen to my body. There were like many years of pushing, and this mindset that more is always better. And after 3 years, you're like, clearly something isn't working. And coming to that realization, I worked with a nutritionist during this time because part of me was like, okay, maybe I'm not fueling enough. I also worked with a therapist to understand, like, why did I feel this need to just like absolutely run myself into the ground constantly. And I think between that and just like I had this talk with myself, I'm like, you know what? You're just going to try for 3 months, train a little less, see what happens. And during that 3 months, I felt infinitely better. I'm like, oh, I just slept through the night. Imagine that.
Yeah.
And it's like one of those things where like you knew all along, you just weren't willing to like accept it.
Yeah.
Yeah. So a lot of it was just accepting what I already knew.
Yeah.
Yeah.
That is so much. That's such a huge part of the work that I do too with my clients is you are not the only one to make that mistake. I think that is more of the rule than the exception. Whatever the thing is that they're overlooking. And it's like, a lot of times, what you need to do, you just don't want to do it for one reason or another, whether it's you're training too much and you don't want to stop because then you feel like, whatever emotional thing is going on in the background, you feel like you're failing, you feel like you're not working hard enough, whatever the thing is. Or it's, I know that I'm scrolling on TikTok a lot and I know that I don't feel good after spending 2 hours scrolling through these, short form content, but I don't want to stop doing it. So I'm going to, pretend that that's not affecting me like it is, or, insert, maladaptive practice here.
Yes.
Absolutely. So has that helped you shape your training with other clients?
It's a good question as well.
Mm-hmm.
Yes and no.
Mm-hmm.
I've thought about this a lot because there are kind of like these two buckets of people, the people that truly aren't doing enough and the people who are overdoing it. And I do think that we have to almost show ourselves that we can be strict and find these extremes before we can find what moderation is for ourselves.
Yeah.
So I don't know that I would like change any. Maybe I would have, taken action a little sooner. But I do think that you kind of have to find your limit to know where a moderate approach is.
Yeah.
And so I think I am just a little bit more curious with my clients. I ask them questions about how they're sleeping. Is it feeling like it's becoming too much for them? Like, and you get to know people. Like when I sit down with someone, I'm like, you're type A, you're like me. These are the things you likely struggle with.
Yeah.
And then there are the other people. And so my approach really varies depending on the person in front of me.
Which it has to, right? Because there's so many different types of people that need different interventions, whether it's training or not. And you can't train with them every single time. So you have to, work with them. And the goal is to teach them how to recognize these things in their own bodies, right? Because they know their bodies way better than you ever could.
Absolutely. Absolutely.
So yeah, the key is teaching them how to recognize these signals. But that is so often ignored these days, whether it's through distraction, whether we're just going all the time, or another thing I've seen is when wearables like this Aura ring that I'm wearing, I love them for a lot of reasons, but there's a lot of people who can't wear them. Either they get hyper fixated on the numbers or they use the numbers in place of their intuition. So
Absolutely.
rather than using it as an enhancer of like, learning information about how to gauge their own intuition, they use it in place of that. No tool is perfect. They're all approximations.
Right.
And again, you know your body way better than any wearable can. So wearables are great until they become replacements for intuition.
Yeah. Yeah. In kind of the fitness space, we talk about this like term, it's like auto-regulation. But it's kind of same thing as intuition. It's like getting in tune with your body and like, do we really scale back training just because your Aura ring says you're under recovered? Well, maybe you actually feel great and you missed an opportunity to PR because, oh, my Aura ring says I was under recovered.
I was only a 74 today, so
there is so much to be said for just getting in touch with your body.
Yeah. I have similar stories, of course. I am a type A overachiever type. And there's been several instances where I've been a little overconfident in my own health care. Partly because there's a lot of things here, but my biggest mistake that I've made in my own health is just doing interventions without a goal. So letting my, expertise come into play in a not so helpful way. So I thought that I had all the knowledge. I've been, studying all of these pathologies and interventions, and I've been listening to the experts, the leaders, the absolute cutting edge in the field who are talking about all the benefits of, whatever it is, fasting, of magnesium supplementation, of, XYZ. And it's like, okay, got it. I'm going to do that. And a little naivety in thinking that like I should be taking the same amount as my husband, which has gotten me, there were some white hairs that grew from some of those things. I ended up over supplementing and suppressing some copper and then got some white hairs, but since resolved, mostly. But the overarching point is just like, I felt good during this time. And I found myself in these kind of intense protocols of, fasting or whatever. Fasting's a great example of one because every leader in the field of longevity was totally 100% sold on fasting for a couple years.
Right.
So it's like, okay, if I feel good now, but if I want to stay feeling good, then I better start fasting and, yada, yada, yada. So I started doing that. And then my labs got a little funky and my, cycles got a little bit less good. And there was some like just really small signs. And then, of course, just after I figure that out, then all of those leaders are coming out saying, actually, just an hour of HIIT exercise a week or, whatever, 30 minutes has as much autophagy as a 72-hour fast. So don't worry about fasting. You actually need to fuel your body and then just exercise. And it's like, that's way easier. I was already doing that. But that really gave me the perspective of like, hey, A, focus on the fundamentals, and B, make sure that you sit down and take the time to have a goal, not someone else's goal, not borrowing from someone else's body or someone else's symptoms or someone else's goal or their before and after picture or whatever you're scrolling through that, this supplement totally changed my life and, you need to be on this if you want to lose weight or blah, 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 blah. But actually, what are your goals and what does it actually mean to you? So like, why? So you want to lose 50 pounds. Why do you want to do that? Is it strictly aesthetic? Is it strictly, because you want the health, the feel good, the energy that comes from that, and shifting your goals so that they're actually productive and they're actually meeting what you are trying to do, not just the superficial first line goal that you pops into your head. So, and then from there, finding the markers that act as your milestone. So whether that's symptoms of like flare-ups or, whatever your problem is, or what biomarkers are going to be helpful in making sure that you're on the right track and that you're not veering down the wrong one or a dangerous one. But it's really all about experimenting in a safe place. So medicine and healthcare and being in your best health is not a one size fits all. There is no one right answer. You can get two different people with the exact same set of symptoms who arrived at those symptoms for totally different reasons. So understanding and trusting the process of like, we might try something and it's not going to work. And rather than getting discouraged there, which is a really easy trap to fall into, just understanding that that's part of the progress. That's part of the process. That is a note of progress because now you have a shift. Now you know where to go. You know what works and what doesn't work. And then staying on track with consistency. So doing a diet or whatever, an exercise routine for a week is not going to change the scale. It's just not. You have to do these things with enough consistency and doing them one at a time. So just allowing the time for the process to work. This is where having a guide on this journey is so valuable. And I've learned this even in my own health, like having somebody that has that 10,000-foot view. You know, your doctor has a 30,000-foot view. They're watching for signs of disease where you're absolutely going off the cliff. But you need somebody who's not quite boots on the ground, but that has a perspective of like, hey, I know you didn't feel that great this month, but here's some wins that you had, and here's how we're going to shift so that we can stay on your track. That has been really beneficial too.
Yeah. I love what you said, or you alluded to, that this is kind of like an iterative process.
Absolutely.
We don't always get it right.
Yeah.
And what makes you successful is that you continue to strive to be better and like make these little adjustments. And it is like so cliche, but it is a journey.
Yeah.
Like we make mistakes. Expect that you're going to make mistakes.
Yeah.
Learn from them and keep at it. Like that's how we make progress with our health.
Yeah, I say that wellness is way more of an art than it is a science. Not to be said that there isn't a lot of expertise that needs to shape that art, but it's you just have to be on the path.
Yeah.
And even like what works for me great now might not have worked for me in my 20s. It might not work for me in my 40s or 50s and beyond. So like even within my own self or my clients' own selves, like what works for you even now might not be the thing that works for you forever. Your terrain is always changing.
Yeah, we're all just living life for the first time.
Exactly. Okay, so let's go into a fun segment here.
Okay.
I've got some rapid fire for you. Okay, so you give me what if this is a myth, a mistake, or misunderstood, and like if you need a little one-sentence clarification, that's okay. But like most,
am I allowed to say it's spot on?
Yes.
Okay.
Yes, absolutely. Okay, here we go. You need to get 10,000 steps a day.
Misunderstood. Arbitrary number.
Ah.
Yeah. If you're getting 10,000 steps a day, that tells us some good things. Do you always need to get 10,000 steps? Maybe not. Maybe not.
Yeah. Is there also a different, I'm completely killing the rapid fire format here. There's a difference too between getting 10,000 steps in 30 minutes on a treadmill versus 10,000 steps throughout the day too, right?
Yeah. I think one just indicates that we are living a more active lifestyle.
Yeah.
Versus like I live a very sedentary life, but I do exercise.
Yeah.
But I can say for myself, I don't always get 10,000 steps a day, but that's partly because I'm on my feet all day. And when I do my cardio, I get on the bike.
Yeah.
And I'm lifting weights. And does that mean I wasn't active that day? No.
No.
Yeah.
Yeah. Okay. Back to the format. You have to feel sore for a workout to be effective.
Total myth.
Lifting heavy makes women bulky.
Misunderstood.
Tell me about that.
Not the whole point of lifting weights, but for a lot of people, we're trying to put on muscle mass. And you could say muscle mass is bulk. You are trying to like increase the size of your muscle. But I think the difference here is that when people think of someone who is bulky, they're often not thinking of the muscle. Maybe there is muscle, but it's fat that creates a bulky look. And putting on muscle happens to be one of the things that's going to help you keep your body fat at bay. So yes and no. Yes and no.
Okay, next one. You have to do lots of cardio to lose fat.
No.
No.
Myth.
No pain, no gain.
Oh, misunderstood.
Tell me about that.
Yeah. Do we need to be like in excruciating pain? No. But I do think that a lot of people would benefit from increasing their tolerance for some discomfort. But discomfort and pain are very different. But I think a lot of people perceive discomfort as pain.
Yeah.
So maybe no discomfort, no gain, but we don't need like true pain. Yeah.
I'd like to do a whole podcast on that topip. I love that.
I would love that as well.
Yeah. Machines are better than free weights.
Also misunderstood. I really like to incorporate both in my training. If I had to choose one, I would choose free weights over machines, but I love a good machine. Like they absolutely have their place.
You shouldn't strength train past a certain age.
Absolute myth.
If it hurts, don't move it.
Also absolute myth.
Rest is always the answer after an injury.
The biggest myth of them all.
Do you want to elaborate on that one at all?
Sure. Yeah. This could be a whole nother podcast as well. But our bodies, we're made to move. And do we need to be going all out? No, but like there's nothing more powerful than a walk when you're injured. Getting your body moving will do so much for you. Yeah.
Okay. Foam rolling breaks up knots and scar tissue.
Myth.
Walking doesn't count as exercise.
Misunderstood. You're moving your body, but if that's all we are doing to move our bodies, you
not
need to be doing
sufficient.
so much more.
Stability training is only for old people or injured people.
Myth.
You should change your workout every week to shock the body.
Also myth.
Women should be training differently than men.
Misunderstood.
Tell me about that one.
I think we've talked about this before, but there's kind of, you'll see two different messages. One says, women are not small men, we shouldn't be training like men. And then another message will say, women should be training more like men. Yeah. I guess I can speak from my own experience. The more my training emulates that of my male colleagues, the better I look and feel. But that's not to say that there aren't differences in how we respond to training. But on the whole, like I think if women can be doing more things like lifting weights, sprint training, jumping, athletic training, and less of the Pilates, the bar, the yoga that's traditionally like female
woman style training,
the better things are. Yeah.
Okay, that was it. That was my last one. Whew. Yeah, quick, rapid fire.
It's like you knew they would all be myths.
Well, they're ones I hear over and over. Do you want to flip the script here?
Yes.
And hit me. Whoops.
Oh, yep. Okay.
Okay, I'm ready.
All right. Cara.
Yes.
Do you need supplements to be healthy?
Misunderstood.
Okay.
I think that it is possible to be healthy without supplements. I think it's really hard to do in the modern food environment, and with the modern stressors that are depleting our nutrients at a faster rate. Again, I'd like to do a whole podcast on that. We can move on for now.
You can catch up on sleep over the weekend.
Myth, absolutely. Consistency is king in sleep.
Practitioners should have their own health totally dialed in.
Myth.
Tell me more.
I think that practitioners need to have a learning mind, and it doesn't mean that they have to have perfect health. And I think it's actually a benefit if they don't have perfect health because they're still in that area of exploration and curiosity and learning. Whereas if you have everything 100% dialed in, then you probably feel great. And if you can start to um, have differences in estimation of the work that your clients are going through. So it just creates a little bit more of a gap.
Mm-hmm. Self-care is selfish.
Absolute myth. Real self-care is not, oh, we'll get to this one in a little bit. Yeah.
Save that bit for later.
Yeah.
Okay. Skip breakfast to optimize longevity.
Myth. If anything, skip dinner and certainly skip late night snacks to optimize longevity.
Calories in, calories out is all that matters.
Myth. That is one thing that matters, but it is far from the only thing.
Um, why is there more to it than just calories in, calories out?
I would say it's information in versus information out.
Mhm.
So the types of the food that you're eating make up the actual building blocks that your body is made out of. I mean, even your skeleton, you have a brand new skeleton every couple months. So like your body is constantly turning over, and it is the quality of which it's rebuilding itself is 100% dependent on the materials that it has, which comes from food. So, 100 calories in broccoli is different from 100 calories in Doritos.
Everyone should be gluten-free.
Myth.
If your labs are normal, you're healthy.
Absolute myth. Normal just means that you are average in a population of very unhealthy people.
I love that.
Yeah.
I love that. You don't need labs if you feel fine.
Myth. Labs act as the smoke before the fire breaks out. So, especially if you're looking at them through the correct lens, you can get a lot of information from labs from somebody who feels very healthy.
Fasting is bad for women's hormones.
Misunderstood. I think it many times is bad for women's hormones because their foundations are not in a way that can adapt positively to that stressor. But when it's done properly and in a controlled environment, it could be really powerful.
Self-care means bubble baths and green juice.
Myth. The real self-care comes from setting boundaries, comes from managing your blood sugar, and comes from having a solid bedtime. The bath is just a bonus.
Love the bedtime piece.
Yeah.
You need a diagnosis to start healing.
Absolute myth. There's a lot of things that we don't know. And even if you have a diagnosis, doesn't mean that we know exactly what treatment's going to solve it. So there's foundational things that almost everyone should be doing to help bring balance and support their health, regardless of the diagnosis.
All right, last one. Health coaches are just accountability buddies.
Myth. Well, health coach, there was more to that came up as I was processing. Health coaching means a lot of different things, but how I see it and how I practice it is I'm more like your health encyclopedia or your health Sherpa because it's a wild and crazy world out there. It's completely the Wild West with so much information and so many scientific studies that can tell you two very opposite things. Health coaches are part detective in figuring out what's going on in your body. They're part strategist in helping you boil down where you're going and where your North Star should be. And they're part cheerleader and teammate.
Awesome. All right, we're on to segment 3.
Okay, so the next thing that I wanted to ask you was what can people do coming away from this conversation? So well, this is a two-part question. So first, what are the themes that you keep coming back to teaching your clients over and over again? Things that are common mistakes or misconceptions that you see people making a lot.
Big ones I see related to fitness are not having any structure to how you're exercising. So following a program is one of the big things I talk about with people.
Yeah.
This difference between just exercising for exercise sake versus training. that's one of the big ones. Something we kind of touched on is just expecting that there's going to be frustrations and setbacks and like learning how to come back from those stronger because you are going to mess things up. You are going to fall off the wagon. You are going to get frustrated on this journey. But the people who are successful are the people who figure out how to adapt and how to keep going.
And then, what was the other part of the question? I lost it.
I don't even remember what you asked.
I don't remember.
Okay.
Oh, well, let's finish up with this.
Okay.
So is there a trend or something that you see in popular physical personal training gyms or social media that is like totally cringeworthy to you?
Oh, I think the one that just gets under my skin the most is like this one exercise to either reduce this certain symptom or to change this certain body part. It's never just one thing. It's accumulation of small daily habits that amount to the change we want to see, but you're never going to cure something with one exercise.
Absolutely. I'd like to mirror that for mine. Well, there's a lot of cringy things that I see now, but one of them is just understanding that one supplement or taking, whatever trendy thing, whether it's, glutathione, whether it's beef liver, whatever is going to help you be healthier in place of doing the actual work, which, like we talked about earlier, you often know what it is. You just don't want to do it because it's hard. But that's the thing that's going to create the real change. The other one that's super cringy to me are these nutrition wars. So the keto versus carnivore versus vegan and how they all it turns into a really heated, like almost a religion type mentality. And it's like, they can all be right for different people. And it's like, just stop everyone, just eat whole foods and 80% of your problems will go away.
Yeah. I think something we both find is like people are looking for these little secrets, right?
Yeah. And they're looking for the quick fix.
Yes.
We've been trained to, though.
Yes, we have. But I think big things are like, you have to be an active agent in your own health. Like passive modalities can help, but the results you're looking for are just really on the other side of like working hard, understanding your body, like getting in tune with yourself.
And sometimes you need somebody else to come in and say, hey, this little blind spot over here, the big blind spot over here, that's what we're working on now. And to have that accountability of like, this is what is going to make the difference, even though you don't want to do it, you're doing it now.
It's so hard to be objective with yourself.
Absolutely. Okay. Well, let's wrap this up now. I know we could go on for hours more and we'll have future segments, but thank you all for tuning in and for listening to our conversation. It was really fun. Thanks for being here, Alina. If any listeners want to find you or find out more about what's going on with you or Eastside Athletics, where can they find you?
Best resources are websites. eastside-athletics.com or our Instagram page, which is just Eastside Athletics.
Awesome. I'll link to those down below too. If you're interested in looking for advice from me about your health journey outside of the gym, you can find me in my practice at unscriptedclinic.com or on Instagram also at Unscripted Clinic. Thanks for being here today, everyone. See you next time. The content provided in this podcast is for informational and educational purposes only and does not constitute medical advice. Always seek the guidance of a qualified healthcare provider with any questions you may have regarding your health or a medical condition. The hosts and guests are not responsible for any adverse effects from the use of this information.